For the flavoring and coloring agent for emulsion, they are used, okay, to increase the palatability and acceptance of patients toward the product. So as an example, vanillin is used to flavor paraffin emulsions, as this will help to mask the taste of the paraffin. The choice of flavoring agent will depends on the character of the active ingredient. So this will be covered more by Dr. Atika, okay, in the pharmaceutical excipients lectures. So color is rarely needed in emulsion, but it is not wrong, okay, to add a coloring agent in an emulsion. As a pharmacist, it is very important for us to ensure that the emulsion that we have is stable during its shelf life. If you are preparing an extemporaneous preparation of an emulsion, the stability or the expiry shall be 4 weeks if you add an preservative, but if you have no preservative, it should be 2 weeks. You have to advise patient to shake the bottle before use. This is important to ensure that the emulsion is homogeneous before taking the necessary dose, and ensure a clear label is available to indicate the instruction to shake the bottle and other necessary instructions such as the storage condition and the dose. As storage is important for the stability of emulsion, you have to explain clearly to patients that this is an important factor. So as a summary, emulsion is a heterogeneous preparation. The stability is very important, and this can be ensured through good formulation and good storage practice. Different types of emulsifying agents are available. Okay, so I missed that. Different types of emulsifying agent. Okay, this is wrongly written. Different types of emulsifying agents are available that can be classified as polysaccharide, inorganic, finely classified, finely divided solids, or surfactants. And also among the common instability problems are cracking and creaming. You have to ensure that the storage condition is good. Okay, the formulation is good to prevent the instability problems from happening. And if it does happen, you should be able to detect, okay, that this instability problem has occurred, and you have to take the necessary action to ensure that the patient did not experience adverse reaction due to instability of the product. So that will be all for the lecture on emulsion. So thank you for your attention. Okay, and that will be all my lecture for this course. Bye.